everyone to our next session on tips for leaders in the COVID-19 pandemic, brought to you by the Australasian College of Health Service Management. Our speaker today is Dominic Sandilands. Dominic has had a long track record in working in many different settings in the hospital and healthcare sectors. He is currently the CEO of the Corryong Health in rural northeast Victoria, and also is an adjunct professor at James Cook University, as well as senior lecturer appointments at Griffith University. He is a fellow of our college, and he has a particular interest in remote and rural health, and I'm sure that this presentation will be helpful to you. All the best.
My name's Dominic Sandilands. I'm a fellow of the Australasian College of Health Service Managers, and I'm CEO of Corryong Health. Corryong is located in the Upper Murray region of Victoria in the northeast, and this year's been a pretty nasty year for this area, not for the least of which reasons is COVID-19, but over the end of last year and New Year's Eve and the start of January this year, we encountered bushfires like this region had never encountered before. So in this recent time, we've encountered back-to-back crises that have resulted and required critical incident management. What I want to talk about is the opportunities for leaders to coach leaders during a crisis. And in reflecting on the last 4.5 months, I can see the benefits of applying a crisis approach to business as usual. And I say that because the outcome of the last 4.5 months of unprecedented experiences has been that our organisation, our teams have come together like never before. Our leadership group is operating in a very cohesive way, and it quite easily could have gone in a different direction. So from a mentoring point of view, I come back to the GROW principles, the goals that we set, the reality that we encounter, the options that we come up with, and then the will, setting actions to achieve. And in thinking about it in that frame, that mentoring frame, I look at our response during a crisis, which for Corryong Health has been quite well drilled. We've returned back to all of our Code Brown processes, the incident control centre, the allocation of roles, whether it be your incident controller or for COVID-19, an infection controller or a clinical commander, and then communications and so forth. So what that brings about is a redefinition of roles and responsibilities, a fresh look. And then within that, we start looking at delegations and giving people latitude to come up with solutions. And then our communication style tends to be checking in much more frequently. Daily huddles, quick, short, sharp daily huddles. And then finally the accountability that comes with that incident control response, which is a project plan mentality and thinking about what our role is, that we need to respond and report back to the group. So my summary of the last 4.5 months from a mentoring perspective and why it is that we're in a better place in some ways from a leadership point of view than we were before comes back to dispersed leadership and giving people latitude to make decisions and a collective will with a single focus. Our challenge moving forward is looking at the business as usual and not being distracted by other things and maintaining a single focus and maintaining that approach to giving people latitude in their roles to lead.